Hola, buenos días, buenas
Good
tardes.
morning, good afternoon, everyone, and welcome to the press briefing of the Pan American Health Organization, PAHO. Today, Wednesday, November 16th, 2022. My name is Luciana Viegas, Public Affairs Advisor. We have interpretation to English, Portuguese, French, and Spanish, and you can access it through the interpretation button. You can ask questions through the Q&A button, and please remember to give us your name and your outlet when you write your questions on the Q&A. We've also received questions through the email, and thanks to all of you who sent them. We begin with the remarks of Dr. Carissa Etienne, who will give you an update on the situation of COVID-19 and other respiratory viruses in the region. We have also Dr. Marcos Espinal, Interim Assistant Director, Dr. Andrea Vicari, Infectious Risk Management Unit Officer, and Dr. Jairo Mendez Rico, Advisor on Emerging Viral Diseases. Over to you, Dr. Etienne.
Thank you, Luciana, and a pleasant good morning to all of you, and welcome to today's press briefing. For a few months now, our region has encountered several compounding health threats that I would like to address today. The Americas are facing a triple threat, so to speak, of respiratory diseases, as COVID-19, influenza, and RSV, respiratory syncytial virus, are burdening our people and our health systems. Over the past week, the Americas saw an increase of 17% in COVID-19 cases, and deaths increased in South America and Central America, despite a modest overall decrease in the region. As we have seen before, the situation can change quickly, and we are watching the trends closely in countries that are reporting higher transmission. We also know that testing has decreased, and the cases reported to PAHO might only be a fraction of the true number of infections in the Americas. Every time we become complacent with this virus, we run the risk of a resurgence. We cannot lower our guard. Meanwhile, cases of seasonal influenza are increasing, following 2 years of below average activity. Flu activity in the northern subregion is rising, as expected around this time of year. However, cases appear to be rising earlier than usual in places like the United States and Mexico. We are also seeing an out-of-season increase in flu activity in the southern cone, especially in Argentina and Uruguay, putting unexpected stress on health systems. At the same time, we are also facing RSV, a common seasonal virus. After a couple years of lower seasonal transmission, RSV infections have increased significantly. High RSV activity is burdening health systems in Canada, Mexico, Brazil, Uruguay, and the United States, and some pediatric hospitals are reaching capacity as a result of this surge. Unfortunately, RSV has a great impact on the most vulnerable among us, our children, and particularly infants under 1 year old. You know, the rise of a single respiratory infection is a cause for concern. But when 2 or 3 start impacting a population concurrently, this should put us all on alert. Encouragingly, the strategies that we use to limit the spread of COVID-19, like masking and social distancing, also apply to these other respiratory diseases and can continue to be used to help communities keep safe. Health authorities should encourage these practices anytime respiratory infections rise in their country. This is our best option for RSV, a disease that does not yet have a licensed vaccine. But we are fortunate to have effective vaccines against the flu and COVID-19. Yet, October saw another decline in the number of people completing their primary series of vaccination against COVID-19, and the number of administered boosters has also fallen. PAHO continues to procure vaccines for member states through the revolving fund. This year, we have provided 39.5 million vaccine doses against COVID-19 and 31 million flu vaccines to countries in our region. We have enough vaccines to keep us all safe. Please, let's use them. Countries should also strengthen genomic surveillance along with disease surveillance more broadly to ensure that we can address each of these viral infections appropriately. Let's remember that a health threat in any of our countries is a health threat to the region, and we must share this information to face it together. Before I close, I want to briefly address additional outbreaks that are ongoing in the Americas. First, the cholera situation in Haiti continues to worsen. Health authorities have confirmed over 700 cases since early October and are investigating more than 7,000 suspected cases. So far, 144 cholera patients in the country have died during this outbreak. This is a dangerous situation, and PAHO urges all countries to increase vigilance while we support Haiti in providing life-saving care to patients, deploying health workers, and facilitating access to fuel for health facilities. Second, although the Americas are still the region most impacted by monkeypox, cases have fallen in most of the severely affected countries. We must take advantage of this momentum to drive monkeypox cases to zero as quickly as possible. To successfully reduce transmission and treat existing cases, governments must continue to proactively engage with those who are most at risk, primarily men who have sex with men. And finally, on polio, no further cases have been reported in the region, but vaccination remains at historically low levels. Countries must offer catch-up vaccinations for polio to all eligible children immediately. We must remember that polio spreads silently and it has no cure or treatment. Vaccines are our best tool to prevent this disease. It took us decades to eliminate polio from the Americas, and we will and must not give up now.
Thank you, Dr. Chen. Pasamos ahora a las preguntas que recibimos por correo electrónico.
Now we go to questions, first with Matias de Lee from Medscape in Spanish. Matias wants to know, how much in agreement are you with the concept of the immunologic gap or immunologic debt to explain the increase in cases of RSV, influenza, and other respiratory viruses? Is the immune system like a muscle which was not trained for 2 years when we were confined, and now it makes people more vulnerable? Dr. Espinal. Yes, thank you, Luciana, and thank you for your question, Matias. When the immune system is having a break, and it's exposed to common germs, bacteria, viruses, and other microorganisms that can cause disease. For example, when you're outside your home, in a restaurant, at the gym, at work, we are in contact with all kinds of pathogens, which usually help us keep our immune system in shape. And it's always on alert and prepared to protect you from infectious diseases. But what happens? Yes, during the pandemic, as Matthias said, in the last couple of years, people took measures such as physical distancing, use of masks, remote work. All of this was important to stop virus transmission. So it makes sense that that immune gap exists because our immune system was not as exposed. It was less exposed to other infectious pathogens. We've always been exposed, but when we are at home, or when we working remotely, and then this led to this immune gap. And this is maybe the reason why so many respiratory viruses like RSV, influenza, are increasing more than usual. There is the so-called hygiene hypothesis, a well-known hypothesis where in very sterile environments, super clean environments, in other words, they don't allow necessary exposure to germs in order to educate, train the immune system, which can then help us to maintain an immune response. And this is why it is said that those peaks that we are seeing, because let's remember that influenza back in 2020 and 2021 was not very strong. And it was precisely because of that the immune gap theory is now circulating. And this is why we should help our immune system with good diet, maintaining up our vaccine shots, with exercise, with all of that, it helps us maintain a good immune system, an effective immune system. Thank you. I hope I answer your question. There's a follow-up question from Elena Pacuar from El Comercio, Guayaquil, Ecuador. The question is, why do we see more of an impact of the RSV virus and influenza virus in children, Dr. Espinal? Yes, thank you, Elena, for your question. Yes, the question is related to the prior question. It's like the other end of the spectrum. What can happen now that we have many children who are immune naive to these seasonal diseases? Pregnant women, for example, pass on antibodies that protect their fetuses in utero, but these women were not exposed to those pathogen varieties because they were at home, they were working from home, they were wearing masks, they were not exposed to those pathogens. So those antibodies were not transferred onto the babies in utero. And so they have not developed immune responses to them. And in many hospitals, in many countries, they're seeing increases in hospitalization of children due to RSV. So children are at a higher risk. And for this reason, we relate this to the immune gap. And what is important is to, again, stimulate the immune system in children, keep up the vaccination schedules, and there's nothing as effective as vaccines. This is one of the greatest inventions in public health, in science, something that works, that is effective. So please vaccinate your children. The rest is you know, you should not pay attention to people who say that vaccines don't work because they use and they're wonderful. Thank you. There's a second question by Elena Pacar from Diario El Comercio, Guayaquil, Ecuador. What is this sublineage of Omicron, which is predominant now in the region, and what projections are regarding the scope of the sublineage BQ1.1? Dr. Mendez Rico, thank you for your question. As we will know from the beginning of the year and during 2022, the subvariant of concern of Omicron, this variant has accumulated additional variants or sublineages, which are classified using letters and numbers according to their genetics. In the region of the Americas, we have detected BA.1, BA.2, and BA.5. And this latter one, is over 80% of those detected. On the other hand, in the BA.15, there are other sublineages that are being followed right now, especially the one BQ1.1. This sublineage has appeared in Latin America and the Caribbean. It is less than 5% of the sequences reported. However, in the US, there has been a trend to increase with almost 44% of the reported viruses in this country, which could eventually happen in other regions, in other countries in the region. And so this is a process we've seen constantly where certain lineages replace others. And this is the dynamics we see. It is important to say that so far there's no sound evidence or documented evidence indicating that these lineages or sublineages are more aggressive and that they cannot cause more clinical damage. They all are Omicron and they share the same characteristics in terms of transmission capacity and challenge to the immune system. Thank you. Thank you, Dr. Mendez Rico. Now we have a question from Brazil. Anthony from Reuters asked 3 questions in English.
Weeks. Is this a new wave, a new variant, or just a resurgence due to relaxed attention to the virus? And what measures does PAHO advise Brazil to take? Dr. Vicari, please.
Yes, thank you for the question. Yes, effectively, in South America in recent weeks, we are observing an increase in cases, not only in Brazil, but also in Chile and Peru. There are also been increases in death, but to a lesser magnitude in that sense. I think it is as well important to note that in a country as large as Brazil, the distribution of cases, in particular severe acute respiratory infection associated to COVID-19, it means really hospitalized cases, varies by region, with higher activity in Northeast and Northeast, Southeast, Southeast, and the South region. Overall, these increases are smaller relative to the upsurges that we have seen earlier in the pandemic, especially in late 2021 and 2022. In terms of the circulating variants, the Omicron lineage BA.4 and BA.5 have been reported in 8 out of the 10 countries in the sub-region. So in that sense, there is not something special from one country to the other one. So overall, in principle, we expect to observe variation in occurrence of cases during this protracted transition phase of a few years forwards towards a likely endemic transmission in that sense. Our recommendation to the authorities continue to be the need for an ongoing assessment and adjusting the recommended measure accordingly to such risk assessment. And I think it is, to conclude, it is also important to note that the population should follow these recommendations that are emitted by the national authorities and also take the opportunity to get up to date with the COVID-19 and influenza vaccine. Thank you.
Thank you very much, Dr. Vicari. Pasamos a preguntas de México también sobre las
Questions
variantes.
from Mexico regarding the variants. Ana Isin Insuso and Balanca Valadez from Grupo Milenio have similar questions. They ask about the situation in Mexico regarding subvariants, which are the most dangerous ones. And Anais says that 16 cases of BQ.1 and BQ1.1, which is called a dog from hell, are they very contagious, Dr. Mendez Rico? Thank you very much for your questions. The first thing that I would like to highlight is that Mexico has always characterized by having one of the soundest genomic surveillance systems in the region. They have a national network, and they've been able to show the presence of different variants over time and the different lineages and sub-lineages of Omicron. For epidemiological week 42, they reported the infection of 45% of the viruses as BA.5. And as we answered before, this is one of the lineages of Omicron, and among BA.8.5, there is the BQ1.1, and there are other sublineages that are sporadic in circulation. Thank you very much for your question, though, because I can say something that so far that we would like to highlight right now, and it is that we have not defined any variants of concern. We continue to use the same nomenclature, which is based on Greek letters. Other denominations and other names circulating in social media, such as Andromeda, the hell dog, they are not accepted by the World Health Organization or by PAHO. We need to be very careful because these kinds of names can generate confusion. And as we said before, so far, none of these sublineages has been associated to an increase in the number of cases, nor to more severity and seriousness. So again, thank you for your question, because this has given me the opportunity to comment about this. We should avoid these names because they create confusion among the population. Thank you very much. They are not official names. Thank you. Thank you, Dr. Mendez Rico. Blanca has a follow-up question. Is it necessary to change vaccines because of the new variants? So could you comment about this, please? As we said before, vaccines that have generated from the beginning, from the first generation, continue to be very effective and efficient for all variants, including all sublineages, and also taking into consideration the different options. All the different vaccines are effective for Omicron. As the Dr. Etienne said at the beginning of and during her remarks, vaccines continue to be the best way to prevent serious disease, regardless of the variant, the lineage, the sublineage. They continue to be highly effective, efficient, and these vaccines work with new variants and sublineages. Vaccines, as they were originally designed, continue to work very well, and they are part of the tools and the armamentarium we have right now. Thank you, Dr. Mendez Rico. We have a last question from Mexico about meningitis cases. Blanca Valadez from Grupo Milenio asks, what do you think of meningitis cases in Durango? Dr. Vicari. Yes, thank you for your question. In fact, we are aware of cases of aseptic meningitis in patients with surgical history in Durango, and national authorities continue to update us regarding the research they're doing about this. We should highlight that aseptic meningitis has many causes. It could be due to a transmissible disease, but it can also be due to other causes, non-transmissible diseases. So we are waiting, we are following the assessments and research being done both at state level as well as at national level, and we are waiting to see what the denouement of this research can be. There are many possibilities regarding aseptic meningitis, but it seems that this is a focalized situation and being well followed by the authorities. Thank you. Thank you, Dr. Vicari. So next question from Henry Cardenas from La Prensa, Panama. Henry asks, how have you assessed the situation of Panama regarding COVID-19, taking into account that there has been an increase? Yes, I think this is a very similar answer to what we have given before regarding Brazil, where yes, there are occurrences that we can expect in this prolonged phase of transmission, which will last possibly for a few more years until it becomes endemic transmission. In Central America and Panama, we have seen an increase in cases in a decreasing phase in recent weeks. Costa Rica reported a decrease in cases and El Salvador had no cases. So within sub-regions, we can find different scenarios in different countries, and this is something that is to be expected. Again, let me emphasize that the number of cases is relatively lower than what we saw in the past, and this is important to remember. What we continue to recommend to authorities and colleagues in the countries is to update risk assessments, and based on risk assessments, you will adjust measures that are recommended and taken for the population. And for the population, then it continues to be important to follow these recommendations and again, be updated on vaccines against COVID, vaccines, the flu vaccine, and other seasonal needs vaccines necessary.
Thank you very much, Dr. Vicari. We have a question by Daniel Coyin from Guatemala, and it says that Guatemala issued an alert due to influenza. Should they strengthen it or expand it because of the VRS? And is it possible to have new COVID-19 measures? I imagine that they're talking about strengthening measures in El Salvador, in Guatemala, rather. Dr. Rico, influenza will continue to have an impact and also have an important pandemic potential. And as indicated, we should recall that the COVID-19 pandemic is still going on, and other respiratory viruses such as the syncytial virus add to this situation. PAHO has been working with the countries to adjust and implement comprehensive surveillance systems to detect in parallel COVID and the flu, also bearing in mind the potential differences in terms of presentation and circulation patterns. At the same time, we are encouraging the countries to carry out surveillance for the respiratory viruses, implementing the algorithms for this type of viruses. So with this, over the next couple of months, we expect to strengthen regionally comprehensive surveillance for COVID and the flu, which are efficient and also allow for early detection of any changes that could imply an impact. And to that end, we expect also that the countries follow the guidelines and continue with the integration path for surveillance of the respiratory viruses. I hope I have addressed the question. I thank you, Dr. Mendez Rico. We have reached almost the end of our session today. We have a final question for the director of PAHO.
We have tools to help limit the impact of diseases Can you give us an update on PAHO's initiative to increase the regional manufacturing of such tools, including vaccines? Dr. Tien, please.
So, well, let me thank you for this question. As you know, in 2021, I launched the PAHO regional platform to increase the manufacturing capacity for medicines and health technologies in Latin America and the Caribbean. This is a key strategic action to increase our ability to respond more quickly and in a more autonomous manner to future health challenges and to improve access to much needed vaccines, medicines, and other medical supplies. This effort is progressing, and our work on regional mRNA vaccine development with WHO countries and the medicines patent pool continues, with agreements underway to facilitate tech transfer processes. We have facilitated the training of 2 partner institutions, one in Brazil and one in Argentina, so that they could learn about mRNA vaccine development. We are also completing an extensive market review to identify opportunities to strengthen manufacturing capacities for health technologies in the region with the support of the United States of America. And with partners such as Canada and the European Commission, we expect to intensify work with countries to broaden product development across vaccine technology platforms, not just mRNA vaccines, and to support the technology transfer from pharmaceuticals. Next week, we will enter into discussions with regional groups such as Mercosur and CELAC, ensuring a truly regional approach in our efforts. So while this may take some time to bear fruit, these activities will, in the long run, prevent the scenario that we had during COVID-19, where countries had to cope with issues of inaccessibility, delays, vaccine shortages, and high prices. Importantly, those efforts will leave the region better prepared for the future. I just need some final words as we head into the holiday season and travel to celebrate with families and friends. Let me say that we must be especially vigilant about all of the health threats that we spoke about earlier. There are 2 key lessons from the COVID-19 pandemic that I believe will serve us well today. The first one, a recognition that we are not powerless. The last few years have demonstrated that our many tools and resources will help us limit the impact of severe respiratory diseases as long as we use them. And 2, we have learned that our health is interconnected. We must continue to respond to this crisis together as a region, using every opportunity to collaborate and to share the information that we have across all of our borders. Please, let us not take these lessons for granted. Let us ensure that as a region that we shall continue to improve the health and well-being of all of our people working together. And thank you very much for joining us for this press conference.
Thank you very much, Director, for those very important closing words, very, very timely. Llegamos ahora al final de nuestra sesión. A los periodistas.
We have reached the end of our briefing. The recording will be available on our website, and we will be sharing further information on the next press briefing via email. Please be aware that you will be receiving that email, and also send us emails at mediateam@paho.org. And please remember that you can find further information such as number of current COVID cases, cholera, and also monkeypox on our website. Thank you very much once again for connecting, and see you soon. Greetings. Thank you.